As our loved ones grow older, it can be incredibly difficult to face the reality that their time with us may be coming to an end. While it's painful to think about, recognizing the subtle signs that an elderly person might be in their final year can help us prepare emotionally and practically, ensuring they receive the care and support they need. Let's dive straight in. Number 1. Decreased appetite and thirst. A significant reduction in appetite and thirst is a common sign that an elderly person may be in their final year of life. This phenomenon occurs because the body's metabolism slows down as vital organs begin to shut down. Research shows that 15 to 30% of seniors experience anorexia due to aging, which can manifest as a lack of interest in food or drink. This is not merely a symptom of aging but an adaptive process where the body prioritizes energy conservation over digestion. What many people might not know is that this decline in appetite is often accompanied by changes in taste perception. Studies indicate that elderly individuals nearing the end of life may lose their ability to taste sweet or salty flavors, further diminishing their desire to eat. Additionally, the digestive system naturally slows down, making it harder for the body to process food, which can lead to discomfort if they eat more than they can handle. Practical care tips include offering small sips of water or easily digestible foods like soups or smoothies. However, caregivers should avoid force feeding, as this can cause distress or even choking due to weakened swallowing reflexes. Understanding these changes can help families provide comfort rather than focusing on maintaining caloric intake. 15. Number 2. Changes in breathing patterns. Irregular breathing patterns are another subtle but critical indicator. Known as Cheyne-Stokes respiration, this involves alternating periods of rapid breathing and apnea, pauses in breathing. These changes occur because the respiratory system is gradually shutting down due to decreased oxygen levels and reduced circulation. A lesser-known fact is the occurrence of the death rattle, a gurgling sound caused by fluid buildup in the throat and lungs. This sound is not painful for the individual but can be distressing for loved ones to hear. It results from weakened throat muscles that can no longer clear secretions effectively. Caregivers can provide relief by repositioning the individual or using suction devices to remove excess fluid. Keeping the room calm and quiet can also help reduce anxiety for both the patient and their family. Recognizing these signs allows families to prepare emotionally and seek appropriate palliative care. Number 3. Withdrawal from social interaction. Elderly individuals nearing the end of life often withdraw from social interactions, preferring solitude over company. This behavior stems from both physical exhaustion and psychological resignation as they prepare for the end. What many may not realize is that this withdrawal is not necessarily a sign of depression but a natural coping mechanism. Interestingly, some individuals may exhibit moments of clarity or increased engagement shortly before passing, known as terminal lucidity. This phenomenon remains poorly understood but could be linked to a temporary surge in brain activity as other bodily systems fail. Families should respect their loved one's need for solitude while remaining nearby for support. Gentle communication and physical presence, such as holding hands, can provide reassurance without overwhelming them. Number 4. Increased restlessness or agitation. Restlessness or agitation often manifests in repetitive behaviors like fidgeting, picking at bed linens, or moving limbs aimlessly. This could be due to discomfort, unresolved emotions, or neurological changes as the brain begins to shut down. What's less commonly known is that restlessness might also indicate unaddressed pain or anxiety about dying itself. Some experts suggest that these behaviors could be expressions of existential distress rather than purely physical symptoms. Caregivers can help by creating a calming environment with soft lighting, soothing music, or aromatherapy. Medications may also be prescribed to manage severe agitation if necessary. Number 5. Changes in skin color and temperature. As circulation diminishes, skin may take on a pale, bluish, or mottled appearance, especially on extremities like hands and feet. This occurs because blood flow is redirected toward vital organs as the heart weakens. Many people are unaware that these changes often start weeks before death and are not limited to the final hours. Cold extremities are another sign linked to reduced blood flow. Families should note that providing warmth with blankets can offer comfort but won't reverse these physiological changes. Understanding these signs helps caregivers focus on comfort measures rather than attempting interventions that won't alter the underlying process. Number 6. Hallucinations or vivid dreams. Hallucinations or vivid dreams are common among elderly individuals nearing death and are often misunderstood as signs of mental illness. These experiences may involve seeing deceased loved ones or revisiting meaningful places from their past. 17. Neurological studies suggest that these phenomena could result from altered brain chemistry as oxygen levels drop and neural activity becomes erratic. Interestingly, many cultures interpret such visions as spiritual transitions rather than medical symptoms. Families should approach these experiences with empathy rather than skepticism. Validating their loved one's perceptions, even if they seem surreal, can provide emotional comfort during this profound stage of life. Additional knowledge to know about end-of-life signs. Understanding the signs that an elderly person may be in their final year is crucial, but it's equally important to recognize the broader context of these changes. Here are some additional insights that can deepen your understanding and help you navigate this sensitive time. 1. The role of the dying process. The process of dying is not a single event but a gradual shutdown of the body's systems. This process can begin months before death, with subtle signs like fatigue, reduced mobility, and cognitive changes. Many people mistakenly believe that these signs appear only days or hours before death, but they can manifest much earlier. 2. Emotional and spiritual awareness. As the body declines, many elderly individuals experience heightened emotional or spiritual awareness. Some may reflect on their life, seek forgiveness, or express gratitude. Others may exhibit a sense of peace or acceptance, even if they were previously fearful of death. This emotional shift is often overlooked but can be a profound part of the dying process. Supporting these emotional needs is just as important as addressing physical symptoms. 3. The impact on caregivers. Caring for someone in their final year of life can take a significant emotional and physical toll on caregivers. Studies show that caregivers are at increased risk for depression, anxiety, and burnout during this time. Understanding the signs of impending death can help caregivers prepare mentally and emotionally, reducing feelings of helplessness or guilt. 4. The importance of palliative care. Palliative care focuses on improving quality of life rather than prolonging it. Many families are unaware that palliative care services can be introduced long before hospice care is needed. This approach addresses pain management, emotional support, and spiritual needs, ensuring that both the patient and their loved ones receive comprehensive care. By recognizing these additional aspects, families can better support their loved ones and themselves during this challenging period.